This is Dr. Al-Hamamsi, one of the teaching faculty in the Internal Medicine Residency Program of Memorial Hospital. I'm recording this video to orient the incoming interns on how to write a history and physical note or an admission note. You write this note when you're admitting a patient for the first time, seeing a patient for the first time, let's say admitting the patient from the emergency room. Whenever you write a patient note, you need to have two identifiers for your patient. Let's say the patient's name and the patient's date of birth. You can also use the medical record number. After you're done with the note, you need to write your name so people know who you are. You need to sign your note and you need to write your pager number so that people can reach you if they have questions. These are the components of the admission note. First component is chief complaint, which is usually concised, something like chest pain or fatigue. And then history of present illness, where you describe the present illness, would sound something like 55-year-old man with a past medical history of hypertension and hyperlipidemia, presenting with a chief complaint of chest pain. The patient describes the pain as, and then you go on describing the chief complaint. And then the review of systems. You describe the other systems, so you take the patient head to toe, talk about all the systems, cardiac, chest, neurological system, and see if the patient has any other complaints. And then you go to the past medical history, example, hypertension, hyperlipidemia, surgical history if the patient had any surgeries before, example, cabbage, social history if the patient smokes, drink alcohol, has any history of drug abuse, example, cocaine abuse would be important for a chest pain patient. And then the family history for a chest pain patient, it would be important to state if any of the first degree relatives had an MI at a young age. And then you go to the physical exam. So you start with the general exam, then vital signs, and then you take the patient head to toe and document your exam. And then you go to the data, which is the laboratory data. You write the labs, and then you write the EKGs and the imaging studies. You get them usually from the electronic medical record, from the EMR. And then you write the assessment and plan. So the assessment is your thought process, what the patient has, and the plan is what you intend to do. At the end, you sign your note. I hope that this orientation video is beneficial for the new interns, and writing a history and physical note would be easy. Thank you.